Yeah, I think, whether it's One Medical or some of the companies that I invest in as an angel investor and as a venture partner at Jazz, if you're building a consumer brand, the first thing is you need to treat your patient as a customer, and you need to listen to them, and you need to understand what's valuable to them, and you need to work to meet those needs. And if you can't, you need to manage expectations. And when you make mistakes, you need to say you're sorry.
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
After leading finance and development functions and multinational teams at KFC, Gap, and Electronic Arts, Sharon Knight joined One Medical Group, growing the clinic nationwide. With deep experience in finance and operations, Sharon is now improving wellness and advancing the human health span as a partner at Jazz Venture Partners, where she focuses on building consumer-centric healthcare brands and supporting innovative health tech startups. In this episode, we discuss Sharon's advice for building consumer-centric healthcare brands, approach to treating patients as customers, and her insight on leading teams through significant industry changes. She also shares her strategies for successful investment in health tech and the qualities she looks for in exceptional entrepreneurs. Enjoy our conversation. Well, Sharon, thanks for joining me today.
It's great to be here.
I'm excited to have you. I always like to start our conversation with our guest journey, and because I think it's really important for people to understand where you came from in terms of your experience that shape who you are. So if you can tell us a little bit your background, what brought you to healthcare as well? Because I think you did not start it in healthcare.
Wow. I have an extremely varied background, and one that I could never have scripted. I have a mix of finance, operations, and leadership experience, both in Fortune 500 companies and at startups. The first phase of my career was actually as a commercial banker in Chicago with what is now known as BMO Harris. And then I was there for, about 8 years. I got my MBA at Northwestern while I was working there. And then I moved to Louisville, Kentucky, and I joined Kentucky Fried Chicken. And yes, it is actually based in Kentucky. It was a division of PepsiCo back then. And I worked in strategic planning and real estate development planning and in financial planning and analysis following the spinoff of the restaurant division by PepsiCo and the creation of what is now known as Yum Brands. And then in 1999, I was hired by the Gap, and they moved me to the San Francisco Bay Area. And I spent 4 years there in finance until I was recruited to Electronic Arts, the video game company, by the new CFO who had started there. And I had this amazing experience at EA. I spent 7 years with the company, initially leading corporate finance, and then moving to London for a European product operations role that ultimately led to a role on the CEO's staff, creating a new global shared services organization around all of the game development functions that weren't about a unique IP. And I had a lot of resources, but in many ways it was a really entrepreneurial role. And it prompted me to leave in 2009 and find a role in the startup world. And it was just at that point that I jumped in to healthcare. So really 14 years ago, rather late in my career. And I was introduced through Benchmark Capital to Dr. Tom Lee, who was the founder of One Medical Group, and he hired me as president. And as you know, the company was acquired last year by Amazon after having gone public in January of 2020. So that was a very circuitous route to getting into healthcare.
And so looking back, with all your experience, say, in banking and food industry, and then gaming and to healthcare, what are the common thread that you see? And what are the things that you were so surprised when you're in healthcare that you did not know?
Oh, great question. A lot of people were really surprised and amazed at my career transition then and now. But What I say is, I had a multi-unit retail experience at KFC and Gap that was very translatable when you think about the stage at which I joined One Medical, which was when we had just 3 clinics in San Francisco. We were focused on building a multi-unit retail consumer brand that just happened to be delivering primary care rather than selling fried chicken or denim. So there was a lot that was translatable, even from the gaming world. In the video game world, you're very focused on creating very sticky, engaging experiences that people come back to again and again. And so I think, there was a lot that helped me in coming in as president and really driving, building a new brand in healthcare. Of course, I didn't really know anything about healthcare other than having been a patient from time to time. So I had to learn more of that side of the equation. But I was running the MSO, or the Management Service Organization. So all the functions outside of clinic operations, really with the exception of tech. So I was focused on revenue and scaling operations. So I had responsibility for marketing and real estate, finance, accounting, legal, HR, all the corporate functions, which are very translatable from industry to industry. What shocked me, though, about coming into healthcare was just how hard it was. One of the first things that was just a big head scratcher for me was bringing billing in-house and having to work with payers to put contracts in place when we entered in new markets. And we would negotiate these contracts, and they'd say, Schedule A will contain the fee schedule. And I'd go to Schedule A and there'd be nothing on Schedule A. And I'd say, well, how are we supposed to know how to model our finances if we have no idea what we're going to be reimbursed? And they'd say, oh, well, you'll find out what the rates are when you get a reimbursement. Basically, you just submit. And then so we would fill out, our charge master as we went along, like, oh, that code got paid $180. That one's worth $70. I mean, that's how we learned. I mean, it was nuts. I've never signed a contract before that wasn't fully transparent and revealed itself as you went along. So that was one of the first kind of eye-opening things.
Is it because that time One Medical is small entity and you don't have the leverage to?
We had no leverage and no power. When we went into Washington, D.C., for example, we identified the major employers that would have influence, with the carriers, and we got them to lobby on our behalf that additional primary care resources were needed. And at that time, the ratio, I forget what the ratio was exactly, but the ratio of patients to primary care doctors, or population to primary care doctors, was quite low. And it was an underserved market. And we had employers lobbying on our behalf because they didn't know and really didn't care. So it was early days. Now there's a lot more in the way of boutique primary care models and membership-based models, and the payers are more familiar with those. Just even getting them comfortable with the fact that we were charging a membership fee, and our membership fee at that time when I joined was like $79 a year, and it went to like $199 a year. But that was abhorrent to them, right? And we had to justify all the other ancillary services and benefits that patients would receive, really, that we weren't, competing, if you will, with reimbursable type expenses. So
it's always hard when you're the first.
It is indeed, that's for sure. But lots of people have followed what One Medical built, and so I'm proud of having been part of that early team to have built that.
What was the thinking behind doing the membership when you first?
Yeah, I joined in 2009, and the membership fee was already in place. And we spent a lot of time figuring out what is the right membership fee. Though we had a lot of people who were grandfathered in at $39 and $49 and $59, and we did a lot of focus groups in new markets and tried to understand people's willingness, to pay, because they were using us alongside their insurance, right? So it couldn't be some big extra expense. People are already paying a lot of money, for healthcare. But the idea was people value what they pay for more, and it creates a sense of belonging. We were trying to create a community. We were doing a lot of education. We were using our offices for events. We wanted people to think of us as their medical home, coming for lab draws and coming for travel vaccinations, and really using us very holistically. In the San Francisco market, we actually had chiropractic and acupuncture and some other holistic services. And in New York, we were one of the first clinics to offer mental health as well. So we were trying to, with the membership fee, create this sense of, people were special, they were different, they were belonging, and that they would then value it. The other thing too is, I don't know about you, but I've seen lots of doctors, primary care or gynecology or whatever over the years, who probably still think or count me on their patient roles, right? Once you're a patient, you're always a patient. And you ask somebody how big their practice is, and the numbers are like extraordinary, but that says nothing about how active people are. And with a membership fee, you actually know who your active members are, and you can communicate with them. You can survey them. If they choose to not renew, you can use that as an opportunity to learn from that experience. Why did they not renew? Where was there a loss of value? What could you do differently? What would incentivize them to renew? So it gave you a lot more information and touch points with your patients than a traditional practice would have.
So you mentioned earlier about your experience. Part of it that you carry through is the stickiness, engagement. What are the things that you think is important, like 4 to 5 factors that make your customer or your members to be sticky to your brand that needs to be there, a must-have?
Yeah, I think, whether it's One Medical or some of the companies that I invest in as an angel investor and as a venture partner at Jazz, if you're building a consumer brand, the first thing is you need to treat your patient as a customer, right? And you need to listen to them, and you need to understand what's valuable to them, and you need to work to meet those needs. And if you can't, you need to manage expectations. And when you make mistakes, you need to say you're sorry. And I think a lot of what we were doing at One Medical wasn't novel when you took it out of the context of healthcare, but when you brought it into healthcare, suddenly, it was. But the world has changed a lot. People have high expectations today of their healthcare providers. I'd say higher than they did a decade ago. And I think One Medical was a contributor to that. When I myself would go see a specialist or something, and they should chat with you and they ask you what you do for a living. And I'd tell them, people would kind of groan and say, oh, you've made my life so much more difficult, because we activated consumers to be agents, around their own health, and to have a higher set of expectations around communication, around access and service levels, and the office environment, a spa-like, beautiful, comfortable, modern, even being able to just directly email your doctor without, at that time, going through, some sort of a portal, and your physician was not in a white lab coat. They were much more like your equal and a coach, and somebody helping you navigate your health. It was a very different, experience that maybe doesn't seem as novel today, but at the time was very novel.
I think I used to complain that I think healthcare is the only industry that it's okay for to make the customer wait for more than an hour.
We had, that was one of the things we measured, like you will be seen on time. And we had when people checked in at the desk, and then when they checked in with the physician, and we knew how many minutes had passed, and we measured that, and we reported on it for each physician in each office in each region. And it was one of our KPIs around service.
Yeah, I used to say that if I did not show up, I would be charged. But if they showed up late, I think I should get a refund.
And later in the day, it just gets worse, right? It just slides throughout the day. So on time, experience, but I think really being listened to. And we had longer appointment times too. When somebody registered for an appointment, they're asked, what issues they're coming in to speak about. Is it 1, 2, 3, 4? What is it? and we'd size the appointment time accordingly, or at least we try to. So it'd be a 15, 30-minute or 45-minute appointment. We weren't trying to have an average 8-minute consultation, but really give people time to communicate their issues, for the physician to listen, to confirm, to seek understanding, and really build a relationship.
So now that you mentioned earlier that you're an angel investor, and so you've seen a lot of startups trying to do innovation, solve a lot of problems. What are the things that you see in founders? You invest early. Is ideas change? People bet on the people. What are the kind of people that you're looking for?
That's a good question. I think I don't know that my answer is terribly unique, but looking for big, bold ideas, exceptional entrepreneurs, ideally someone who maybe has had a demonstrated track record before, but not always. A management team that's maybe not fully formed, but coming together, and additional talent that's at the table, that are proof points in terms of the entrepreneur's willingness to hire and attract talent, whether that's in the core management team or in the advisory board that they've been able to assemble. Obviously, a unique product, a large addressable market, but I think that some people say, "Oh, well, do you how much time do you spend looking at projections, things like that?" And I don't, because I tend to invest at seed or Series A. I certainly look at them, but the reason I look at them is I want to see if the entrepreneur understands the business and the levers of the business and how detailed they are. And are they just high level and skimming and simplistic, or are they really in the weeds, and they understand the nuances, and they understand, is the model built in the way that reflects what the key drivers and sensitivities of the business are? So I use it to assess more financial savvy. I've never seen any early company actually hit their early projections. So I don't rely on it that much. I do my own homework on what I think, how big the market opportunity is, and whether this solution is particularly unique or not. But at the end of the day, it's really whether the team is there to deliver the success. So you can have a great product and a great market opportunity, but if the team isn't there, so that comes down to the entrepreneur and their leadership abilities. So I talk to references and people who have worked with and for that person. I heard an interesting term recently. It's not just about leadership, but followership. And so if you talk to people who are in the company, who do they want to follow? And I think that's a great way to put it, is because it's the employees who do the work and deliver and get things done. So who would they like to be led by? Who would they follow from company to company, and who would they stick with through tough times? And who, when maybe cash burn is tough, would take a pay cut and still hang in there? So I thought followership was a really interesting idea.
Yeah, no, that's the first time I heard the term. I think that's really interesting. So I'm sure throughout your investment career time, you've seen company, doing really well, company that go bust. And what are the things that you see oftentimes that make company fail?
Unfortunately, I've had a few that have not succeeded in my portfolio. I think everyone has. I think it does come down to the team and the leadership and focus. I see, we used to call it at One Medical, there's like bright, shiny objects everywhere. There's lots of things you could be doing, but you really need to think about, what are the few core things to focus on that are going to make the big, be the game changers, be the big difference that are going to get you across that chasm to revenue and to truly scaling your operation. So I think distraction is a big issue. Poor hiring, not having the right team, not being judicious in spending, over investing. You'll see companies that raise a lot of money and they feel like all of a sudden they're super flush and now they have money to spend, as opposed to they need to think about now they have money to invest. And it's a very different mindset. Like if an entrepreneur feels the coffers are full and now it's time to open the floodgates, and all of a sudden the burn ramps way high up and they aren't being really judicious about that spending and making sure it's an investment and their spending has an ROI associated with it, and they have a long enough runway to achieve their objectives. I think companies can simply just run out of money before they've gotten to the key proof points. And that in the current environment has been a big issue as well. You just can't assume that the funding environment is going to remain robust.
Right. So as a board member, oftentimes when you see a company get a lot of money, and oftentimes the founder felt like, well, we got the money because we have to grow, and we have to grow, you have to expand. And when you expand, there's a lot of work. You hire a lot of people, and that's when quickly spending goes up. What is the role of the board? Because as an investor sometimes, because they have to deliver what they say they're going to do.
Right. I see my role as a board member being, there's a stewardship element, there's a governance element. It's being brutally honest, but also empathetic, I guess, with the founder and in the team. It's asking the tough questions. It's being prepared for meetings. It's going deep into the numbers, holding them accountable, for, hey, at the last meeting, you said you were going to do X, Y, and Z. Let's make sure we get an update on that. Have you delivered it? If not, why? It's also, bringing resources, leveraging my network and my experience to provide counsel, to bring advisors, potential partners, hiring, to bring more resources to the table to help the company be successful. So I see my role as a board member, being that partner. It differs a little if I'm an independent board member or I'm representing the interests of an investor, right? In the former, I can be a little bit more flexible, right, if you will, than if you're representing an investor who then has LPs who are expecting, returns. Then sometimes you have to be a little bit tougher, if you will.
Right. And when you need to be tough, so sometimes when you work with CEO or the founders, like you're saying, hold them accountable. And then when they did not deliver, oftentimes things need to happen, need to change. Not often, I guess. What I'm saying is that how do you have a conversation with them, and then in order for them not to be defensive about it, because you can say, like, this is what you said. Well, that's not what I said. And people can go tit and tat, like, say, oh, this is not what I said. You misheard me. And I'm just trying to create scenario that where somebody can be very defensive sometimes because this is their baby.
I was just thinking that it is their baby, right? Yeah. Well, I think it starts with, you have to be consistent in your communication. You can't just vault in and be disruptive, right? You have to build a relationship and build trust. And, when you communicate something, seek understanding, put it in writing, do everything you can to make sure that tough messages are understood or that expectations are understood so that it doesn't feel like you're vaulting in with some surprise and you're turning over the apple cart. That's when people get defensive. That's when I've gotten defensive, being on the other side with investors. You feel like somebody's hasn't done their homework and isn't in the know and is having a knee-jerk reaction and hasn't been with you all along and keeping pace and understanding, the business. If that's happening, you have a partnership and it isn't as challenging. But it is people's baby. Startup founders, it's a hard and lonely job. And that in their personal brand is often inextricable with the company's brand. And so it's easy to take things personally.
Yeah. And I think that sometimes it's also helped them, with their drive to make it successful.
Absolutely.
I know we are running out on close on time. I always like to ask this couple of questions. What is the best advice that you ever got? And what is the worst advice that you ever got?
Oh, interesting. Best advice, and I think I've done a good job of living it, is really not to be afraid of change, right? To embrace change and to lean into change. And in my career, I've initiated change very boldly. So I think that was good advice. And for me, it's worked in terms of satisfying my need for continual learning. And I have a high degree of curiosity. And so not being afraid of change. And I think I got that message also really on in my life with my family because we moved a fair amount when I was a kid. And I had to learn to adapt and learn to make friends and learn to, assimilate and learn a new culture and an environment. And so that I've never been afraid of those types of transitions, going into a new company or new industry and establishing myself. So I think that would be the advice. The worst advice, be patient, maybe. I think as women, things are changing. I do a lot of mentoring for younger women in their careers, and they're a lot bolder than I was when I was their age, let's say in my mid-20s and late 20s, is young people today are asking for what they want. They're communicating their expectations. They're when they've felt that they've mastered something and they've learned something, they're ready for something new. They're pushing for it and they're asking for it. Whereas I feel like the messages I got early professionally were very much pay your dues, sit tight. Good things come to people who are conscientious and put their head down and just, deliver, don't rock the boat. And I think as women, we get that message a lot. And I think that's terrible advice. So I think we have to ask for what we want and be deserving of it, right? Have a track record and evidence that substantiates what we're asking for, not be just willy-nilly about it, but having substance to back up our demands.
I think I think I've talked to I think we're about the same age. I think a lot of my colleagues and friends, oftentimes they were saying a lot of the comments, like a lot of the young people always demand, but not knowing where they are at. I think, there's a lot of finding the right balance is always challenging, right? Because again, you have to have something to back it up.
Right. You need to pitch yourself. I think like it's a proposition, and right. What are the pros and cons? Where's the evidence? Why should you, do this for me? Demands don't ever really work very well, but a proposition can work quite well. So it's positioning.
Yeah. No, I think I like that better. I think demand seems very childish in a way. No. So you mentioned about, the change, because change always seems is the only constant thing. Everything changes all the time, but change is not always easy. And I think sometimes it's easy to tell people to change because you have gone through the process in your mind that change is happening. But implementing a change can be hard for others because they have not processed it, I think. Like, what are some of the framework that you use to convince others to change?
So I have this conversation a lot in some of the coaching and mentoring that I do. And I think it's to think in terms of steps, not leaps often. So some people would say, oh, going to One Medical was such a big change from the gaming industry. I said, well, as I said earlier, actually not if you think about it as being a multi-unit retail. And I had this experience at KFC and the Gap. To me, it was a step, not a leap, because I found something to leverage, right? It wasn't like it was big wholesale change. There was a lot of change, given it was healthcare and I had things I had to learn, but there were things that were common elements. So I encourage people to, when they're making a change, maybe they don't take a huge leap, but they find a stepping stone. Like if you were trying to cross a creek, you wouldn't try and jump the whole creek. You'd look for a stone or a log or something that you could hop to, and then maybe to the other side. So I think breaking down change into steps, not leaps, is one. And then I think the other thing is just get started. It's the value of small changes that add up. So I used to say this to my team a lot, like, hey, we're in San Francisco. Let's pretend we're driving to Miami. We don't need to have the whole route mapped out for us, but we know we need to start heading east. So let's just start going, right? So I think that's with change too. Like you don't have to have it all figured out. And I think a lot of people have paralysis because they feel like I can't make a change until I have every I dotted, every T crossed. Everything has to be known. And sometimes you just need to start leaning and start one foot in front of the other and start migrating, whether that's acquiring a new skill or building some new relationships, make you closer to that goal.
Yeah, no, that's good. Last question, I promise. What are the things that many people value that you don't value?
I don't value a lot. I don't value being in the spotlight. I don't value glory and a lot of attention. I value being appreciated, and I value contributing. I try and add value to whatever it is that I do or any person that I meet. But I do that for more the intrinsic rewards of doing it, not necessarily the extrinsic ones. And I'm not somebody who likes to be in the center of attention, particularly. I don't really value that. I value the relationships that come from experiences, but not necessarily maybe the accolades and some of the more superficial things.
Yeah, no, that's great. No, thank you. Thanks for sharing that.
Great.
Appreciate your time. Thanks for sharing your story and your insight. I learned a lot from you today.
Thank you very much. I appreciate being on today and having the opportunity to talk with you. And hopefully your listeners might learn a few things from my experience.
Oh, definitely. Thank you.
Great. Take care.
Thank you for tuning into today's episode of the Health Technology Podcast. We hope you found the conversation insightful and inspiring. If you enjoyed this episode, please take a moment to subscribe, rate, and leave a review on your favorite podcast platform. Your feedback helps us continue bringing you the latest in health innovation. Stay connected with us on LinkedIn and Twitter for updates on upcoming episodes and more. Until next time, keep pushing the boundaries of what's possible in healthcare. I'm Christine Minato, and thank you for listening.